You are very welcome. Thursday the 10th of December already. And this is the day that the FDA will be approving the Pfizer-BioNTech vaccine, I strongly believe. You can watch the proceedings now, they're live streamed, and I'm hoping for the announcement today. So it's going to be quite an important date. I'm going to start off with the UK before we look at the US today. Let's look at this graph first, actually. So the United States going up steeply, Europe on average for the different European countries going down, Canada going up, albeit at a slower rate. So this constant rise, this blip here is delayed reporting from Thanksgiving. But now we are seeing the Thanksgiving surge, which of course we anticipated. I think a lot of people anticipated that. Now let's look at some COVID symptom tracker app data now to start off our thinking about the UK. This shows the number of people infected at any one time, and it's gone down quite nicely. So that's good. So 19,190 new symptomatic infections today. Wales higher, Scotland a bit higher, England on the whole going down a bit. And we have this rather nice graphic of what we could really call the second wave here on the COVID symptom tracker app. So cases going up in September and October, and then I think we'll see them start to dip round about the beginning of November. Yeah, just after that. This graphic's a bit out of date now. They need to update it a bit because that's where we are now. So fairly encouraging signs, it has to be said, from the UK. So the tracker app is saying UK cases have halved since the October peak. So that is that's pretty good news. UK infection survey based on swab tests from all around the country up to 5 days ago. Now there's always a bit of a delay in this data, of course, but it's definitely the trend that the cases in the UK are continuing to fall. Good news. Scotland and Wales, though, look more plateaued, unfortunately. I don't read too much into this. The rates hopefully will start to fall there as well. So average for the last week, just over 20,000 cases per day. And as we saw for today, that's still going down. So just over 19,000 from the last 24 hours. Now, the week before, the cases were 29,000. And 6 weeks ago there were 42,000. So we do see quite a gratifying reduction from that to that, from that to that. So definite reduction in cases. And they calculate the R value in the UK as a whole as being 8 at the moment. Wales 1, Scotland 1, where there's currently 40,000 people infected. And in England, new daily cases are continuing to increase in every region in England. And hopefully this is going to be reflected in reduced tier restrictions in a couple of weeks' time. But there again, the reason they're falling is because we have the tiered measures and the lockdown that we had in England. So daily new cases continue to fall in the over 60s. That's also good news, which of course is good for hospitalizations. Now I think we'll just look at the UK official data. I actually haven't looked at this today, so we'll just look at it together, and it should be quite useful. So let's look at cases first of all in the UK, and again we see this nice reduction in cases there. Cases by specimen date, cases by date reported. Again we see the reduction consistent with the COVID symptom tracker app. Now deaths. We are starting to see the reduction in deaths now as well. So that is days within 28 days, deaths within a positive test. Again, we start to see the reduction. But of course, we know we have the lag in the death rates. Now, healthcare. How are we doing in terms of healthcare provision? Well, again, we see it starting to fall. So we see that, as we predicted, we didn't reach the peak of the first wave. That's patients admitted to hospital. Patients in hospital, we got pretty close actually. We got pretty close. 16,500 at the peak of what we can now call the second wave. Just under 20,000 at the peak of what we call the first wave. But we do see the number of patients in hospital starting to decline. And patients in intensive care, again, starting to decline, but they were always quite a bit lower than the first wave. So it is what we did expect, actually. It's going down. It's going down. It depends on ongoing behaviour, what happens next. We've still got the rest of December and January and February to go, though, before the effect of the vaccines becomes significant. So we're not there yet. This is a respite, but as we'll see, generally in Europe, there's still a lot of COVID-19 around. It has by no means gone away. This is just an encouraging sign, but still a long way to go. Now I'm going to move on now to the United States. CDC trends. In fact, let's look at that now. So this is the official Centers for Disease Control site. Well over 50 million officially diagnosed now. 285,000 deaths. Again, we can look at the cases by state. I always post the links, of course. And we can see the states most affected at the moment. But what's useful on this site is to look at the trends. And we see the trends here. And unfortunately, we see the trend is definitely up. And you can get a rough idea of the number of new cases per day there. Well over 200,000, 217,000 new cases per day, which we can actually call the Thanksgiving surge. And deaths, we can also put those up. And again, we are seeing increases in deaths. And officially there, that number is it going to flag up for us? Well, just over 2,500, but we know the latest number's actually somewhat higher than that, unfortunately, as deaths are going up in the States. The States have got there's a long winter ahead in the States. This is, I'm not pretending this isn't concerning. Let's just look at hospitalizations in the States, actually. Yeah, there we go. I mean, the graph really speaks for itself. Week ending the 21st of November. And this actual number here, of course, is much higher. The trend is continuing, we know from other datas. Right, so this is a concerning trend. Now, Thanksgiving surge, what we can call from mixing during Thanksgiving, the peak of this should be next week, around about another 7 days, and we should hopefully see the peak of that Thanksgiving curve, and I am hopeful that's going to go down. But now I'm really concerned about Christmas and New Year. Let's hope people learn from the Thanksgiving surge that we've seen and could curtail their social activities over Christmas and New Year. So the numbers of new cases vary. So 217,000, 211,000 today. Other sources are saying, though, 220,000. So the sources are varying a bit, but whatever it is, it's over 200,000 cases per day, and it's over 50 million totally official diagnosed cases. And the point is, this is up 10.4% in the past week. That is the trend. Hospitalizations, as we've seen, are up. Hospitalization rates are reported as being very high in California. I mean, the news report actually said 12% of people diagnosed are being hospitalized in California. That sounds awfully high. But hospitalization percentages do seem high. Current hospitalizations, actually this is of 24 hours ago, 106,000 in hospital now, 21,000 in intensive care, 7,500 just over ventilated. The official figure for deaths is high for the last 24 hours, well over 340, over 3,000, 3,140 deaths for the past 24 hours. 280,000 deaths. And I mean, I'm not going to comment on too much on American politics, but for the State Department to be hosting a dinner or something like that, drinks party, with 200 guests at this time indoors is just... But to tell you the truth, you know what, I'm not even going to comment. Now, moving on to the vaccine. So approved Pfizer vaccine, so the United Kingdom first, then Bahrain, then Canada, now Saudi Arabia, and it's going to be the United States today, I am sure. If not, I will be on to apologise tomorrow, but I'm sure it will be. It's just the time difference. I mean, what is it now? It must be about 4:30 in the afternoon here, so the time difference is a factor. Now this is NBC News in the States. Now, I'm not picking on NBC. This is just it just happened to watch a YouTube clip, and it just seems to represent what the media is talking about. So they said that there's mass inoculation started in the UK. For a kick-off, that's wrong. They're not inoculations, they're vaccinations. Get it right. But these 2 allergic cases were a caution shot yesterday, apparently, so they said. And a new warning of side effects. You know, remember, these are 2 people with known allergies who work in healthcare, so decided to go ahead anyway. They both carry adrenaline epinephrine pens. They both have multiple allergies. It's not remotely surprising that 2 people out of the thousands vaccinated, who were in such a high-risk group, had allergic reactions. But this is flagged as a new side effect. It's not. I've been teaching this for decades, literally decades. I remember writing an article about anaphylaxis in 1992, I think it was. I mean, we've known this and this has been known about for a long, long time before this, the small risk with vaccinations with people that are predisposed. And the news report said it's another issue for US regulators to consider. Well, I suspect that the US regulators already knew about this possibility of anaphylactoid reactions. It's a setback for Prime Minister Boris Johnson. No, it's not. It's expected. And then it said, but nevertheless, Canada is going ahead undaunted, as if Canada is just brushing on against this ongoing fire. It's just such a misrepresentation. These risks are known about. Doctors and nurses account for these risks. We ask about them repeatedly. And you know, the idea that this is some big new problem is just not true. So, as I say, I'm not picking on NBC particularly. It's quite a few people are making a big fuss about this, but I'm not. So I'm going to cross that out. The US rollout, FedEx is taking over. So the United States is like an east-west divide. So FedEx is taking the east part. FedEx is taking the east. UPS is taking the west. Population allocation, organised by the military, which is excellent. The packages are going to be chipped, and the temperature is going to be monitored. That's the packages of the 950 something doses, I think, in each package. Now, in 2020, the United States is hoping to roll out 40 million doses. End of January, it's hoping to roll out 50 million doses. And Mr. Biden has said he wants 100 million doses in the first 20 days of his presidency, which of course starts on the 20th of January. And I think that is achievable. It does partly depend on the FDA though, because the Oxford vaccine, which is dirt cheap, dead easy to handle. I mean, the Oxford vaccine, you can get up in the morning as a nurse or doctor on your rounds, put a batch of vaccines in your cold box, put in a few ice blocks, and it'll be fine for the day. You can go around and do your vaccinations. But the FDA will have to approve this first. Now, we had this problem where there was a lower dose given first, then a higher dose. So there's a full trial now being done in the United States. I think 30,000 people are involved in this. But we just saw yesterday that the Oxford vaccine has published peer-reviewed data now, and all the regulatory bodies in Europe and in the UK and in the United States are getting daily updates from the Oxford AstraZeneca team. So if they decide to wait until the formal study is done, they're not going to get official approval until the middle of next year, which basically is going to be too late. And remember, the United States has ordered 300 million doses. So basically, the Oxford vaccine could vaccinate getting on for 50% of the entire population of the United States. And the safety data is good, so I'm really hoping the FDA approve this. I don't see any reason not to approve it, and if I was offered it today, I would take it. And I'm expecting the UK regulatory authorities to authorise it in the next week or two. I would think in the next week or two. So let's see what happens there with the FDA approval. If you want my hunch, I think they will back it probably sometime before Christmas, because the safety data is good, and the efficacy data shows that 100% of people who had the vaccine don't get admitted to hospital. I mean, and the United States needs that from hospitalizations at the moment. So I'm really hopeful that they're going to do that, and I strongly suspect they will. Now, some more news here from the year 1954. Even I don't remember 1954. Well before my time, I'm afraid. Well, not that long before, but certainly before my memory time. Now, Walter Winchell apparently was a well-known writer and person about town at this time, and he said the inactivated polio virus, this famous Salk vaccine, may be a killer. So, step forward a young gentleman called Elvis Presley, and in 1956, the king of rock and roll himself was vaccinated for polio, perfectly publicly, photographed, everything. What a great thing for him to do way back in 1956. The year after that, in New York, for example, 900,000 other people followed his example, and the year after that, cases of polio dropped quite dramatically. So, Elvis, you did a service to the people of the United States and the world by using your celebrity to endorse the polio vaccine. And I have seen hundreds of kids with polio form deformities and paralysis, and it's awful thing. And great that Elvis did that in endorsing the vaccine. But of course, we're not. Polio is virtually eradicated now. Now, tragically, that was 1956 that Elvis was vaccinated. There are still wild cases of polio in parts of, I think, parts of Pakistan and one or two areas. No, none in Africa, I don't think. It's virtually eradicated, but not quite due to security issues. Vaccination teams have been attacked. I know, go and work it out for yourself. Vaccination teams have been attacked. That's why polio hasn't been eradicated. But where are we with the COVID-19 vaccines? Now, I thought just for fun, it would be interesting to note what world leaders are doing on this themselves. So there's a few thousand doses of Pfizer-BioNTech have actually just arrived in Israel, and Benjamin Netanyahu, president, is agreed to public vaccination, which is good. And he probably qualifies anyway because he's 71. Mohammed bin, so I can't pronounce your name, my apologies, but the leader of Dubai, also 71, was vaccinated last month, receiving a Chinese vaccine. So that's already been vaccinated. Now, a certain Vladimir Putin, can't remember what he's in charge of now, but anyway, Vladimir Putin. As far as we know, Mr. Putin has not been vaccinated himself. As far as we know. We do know his daughter's been vaccinated, but has Mr. Putin been vaccinated himself? Don't know. We don't think so. Certainly hasn't mentioned it in public. Joe Biden, Bill Clinton, George W. Bush, Barack Obama. I've heard of those names somewhere before. And anyway, they've all pledged to be publicly vaccinated. So good for you, gentlemen. President Trump has not yet declared. So we don't know about President Trump. Boris Johnson's champing at the bit to get it, as are most of the senior politicians in the UK. But they don't want to do it because they don't want to be seen to be jumping the gun. So it is legitimate. And it's questionable whether Boris would benefit from it anyway, because he's already had it. If someone's already had COVID-19 and they have the vaccine, then that will give their immune system a bit of a boost. But individual doctors will have to decide whether that's appropriate for their patients. But it's if someone's had the disease recently, their level of immunity should already be good, although the vaccine could potentially boost it. But really, we need to be using the vaccine where it's most efficacious at the moment. Now, just a quick look around Sweden, where not Sweden, Europe, starting off with Sweden. But let's look at that now. The Scandinavian countries, Finland, Norway, Sweden. This is per capita, and we see that Sweden's kind of taking off, whereas Finland and Norway are low. Denmark is actually kind of in between there, really. So cases dramatically increasing in Sweden, where of course the lockdown policy has been left up to individual discretion, shall we say. Now, intensive care beds in Stockholm are nearly full. Increasing numbers hospitalised in Stockholm. The numbers don't look high, but we're dealing with a relatively small population compared to a lot of other Western cities. Never imposed a nationwide lockdown, so we'll keep an eye on things in Sweden there, see what happens. South Africa. Bit of a second wave in South Africa. Surge in infections in young people, blamed on nightclubs and university parties for the end of the academic year. So young people, teenagers, young adults seem to be the main drivers of infection. Crowded party, end of school year, and a lot of alcohol seems to have been involved. And Zimbabwe and Kenya, cases also seem to be increasing now. Quite to what degree, we don't really know because the testing is so poor. But the high hopes we'd have that Africa would get away with this until the vaccine arrives don't seem to be being fulfilled. They do have a young demographic. Hopefully there won't be that many cases, but they are increasing at the moment, as are cases in Europe. And this is just a reminder, really, that the cases in Europe have not gone away. So what we've seen in a few places in Europe, unfortunately here, is what we're seeing is, so Israel, for example, this is the Israel line, cases went up, down dramatically, but now they are starting to come back a little bit. This big jaggedy line here is France. This one here is this line here is Slovakia. Dramatic reduction in cases in France, but it hasn't gone away. There's still a bit of a hook there. Germany sort of carry on increasing a bit. So what we see in Europe, and we saw that from the main graphic at the start, that on average cases in Europe are down, which is great, but the virus has not gone away. These are still relatively high figures, and we've got a lot of winter to get through, and the European Medicines Agency isn't even meeting till the end of December for the vaccine, as I've mentioned before. So Germany, more cases. Angela Merkel asked for acceptance of measures. Surprised how much lack of compliance there's been in Germany. And our cases are starting to increase. France, cases are way down on what they were, but they've been very locked down recently, so lockdown measures are being reduced, but not as fast as planned. So restrictions are being eased in France, but not as fast as people had hoped. Czech Republic was another one of those ones that completely scooted up, increasing number of cases, down quite a bit now, but state of emergency is extended for some time and maybe extended again into January. Similar for Slovakia, increasing cases, and then they went down quite dramatically. But the main thing is, what to stress is that it's not gone away. These are still relatively high numbers. So despite the drop in Europe, we still see it's higher than Canada, for example, per capita. And as we've stressed many times, we've got the winter still to go. Fair way to go yet, unfortunately. Let's look at some of your pictures. What have we got? There we go. So this is from Chris in Tamworth. Tamworth is in Shropshire. So we want to be 2 shields apart, so they're quite a nice one. This is the picture series, of course, where we ask people to send in pictures to illustrate what the pandemic's meant for you, what it's been like for you. Things that illustrate it for you. Now, this is Jen in Ontario, and these cones show where different cohorts of kids are allowed to play sports. So I thought that was a really good idea, Canadian organisation, so thank you for that, Jen. This is Kitty from Westlife, California. Restricted gatherings in her park. Now, the next picture is not necessarily pleasant, but I'm going to show it to you anyway. There we go. This is Pepe, who, for reasons best known to himself, has put this on a t-shirt. So, obviously the most complimentary picture of me ever drawn. If you're close enough to read this, he said in small print, "Your behaviour begs credulity." Strange choice of words, Pepe, I must say. I can't imagine where you got that from. So, thank you for that, I think. But Pepe does make a serious point, actually. He's talking about the app in New Zealand that's been greatly improved, apparently. So he's saying it's now open source, so that people can see the code. It uses Bluetooth to ping contacted people. There's a government video explaining all this, and it's got responsible disclosure, so the privacy is good. So thank you. That is from Pepe. I think no, I don't know. I think I quite like it. Yeah, I think I quite like it. Right, so that's from Pepe. So thanks to everyone at Boss and everyone in KiwiCon is the company, I think. Of course, except for SS23, who we don't mention. So there we go. I think that's quite enough of that. So the cases in the States are going up, and it's only going to get worse. I don't have a particular answer, but we do know that universal mask wearing, the distancing, the hygiene, all of the ventilation, all of these things are going to help. Pity about aspects of the leadership not setting a good example at the moment. In Europe, even though things are down, we've still got a long way to go. But the vaccine is coming, and I have high hopes for the Oxford vaccine. I like the sound of being able to transport it around easily in an ordinary cool box. So, okay, that's us for today, I think. Thank you for watching, as always.